Hello, I am Claudio Cerchione. I work in Istituto Romagnolo per lo studio e la cura dei tumori di Namadoro in Meldola, northern part of Italy, and it's a pleasure today to focus about the novelties in multiple myeloma from March 2025 in Orlando. In multiple myeloma, the diagnostic and therapeutic revolution is continuing like in last year, and here in ASH 2025 in Orlando we have seen outstanding results in all the settings of disease. Starting from frontline treatment, in which we have seen recently outstanding data from Perseus CMN17 with the potential progression-free survival till 17 years, and Nimrods in transplant-ineligible patients, in which we have seen incredible data in terms of deepness of response and MRD negativity. However, some new potential studies are exploring new molecules also in frontline setting, and particularly linker MM4 has explored the linvoseltamab as monotherapy in both transplant-eligible and ineligible, and I think that data are particularly encouraging for this new generation bispecific antibody, anti-BCMA CD3. Moreover, also there is a reawakening of carfilzomib in frontline setting, and the COBRA study has compared the KRD versus VRD, showing that proteasome inhibitor could have their sense also in the novel era of multiple myeloma, in particular settings of patients. What about relapsed refractory setting? I think the most important data is MajesTEC-3, in which we have seen a comparison between teclistamab plus daratumumab. Teclistamab, we know perfectly, it's a bispecific antibody, anti-BCMA CD3, together with the daratumumab monoclonal anti-CD38 antibody, with a regimen that spares dexamethasone with a great increasing in terms of tolerability, quality of life of our patient. It is compared to the standard of care, so Dara-PD or Dara-BD. Data are incredible in terms of progression-free survival, in terms of MRD negativity, and also in terms of long-term survival, because this is an important point. There is almost a plateau for the experimental arm, and even if in the first part we can see some toxicity, let's consider that this study started in 2021 when we had no recommendations about the management with the new cellular therapies and bispecific antibodies. Together we know how to perform a best supportive care with intravenous immunoglobulin. In general, we can supplement what the patient needs. We can adequately treat them with prophylaxis, antibiotic, antivirals, and so on. So data could be in some way re-elaborated in the new era of supportive care for cellular therapies. We have seen a confirmation of CARTITUDE-4 trial. We have seen also a confirmation of anito-cell data with an overall response rate of 97%. And another really important molecule, new generation bispecific antibodies, anti-BCMA CD3, is etentamig. In combination with the pomalidomide, has shown exciting data in terms of deepness of response, but also in terms of tolerability. I was one of the investigators, co-author of the abstract that has been presented here, and I can confirm that synergism between etentamig and pomalidomide is exciting, and also the tolerability is wonderful. So I think that we will see more combination with etentamig and also further phases of development for this drug. Interestingly, we have seen also that for patients that don't respond or lose the response to the conventional used drug, we can see new mechanisms of action that are in some way being developed. KTX-1001 is an SD2 inhibitor, particularly active in patients with a translocation of 414, but not only. In fact, in the study we can see a great population independently from the cytogenetic characteristic. Outstanding data in terms of response if we consider that this is an heavily pretreated population, and I think that data are encouraging for further developing this drug. KLN-1010 is a really interesting CAR-T. This is a first-in-human study, and I have to say that not only the effectiveness is fantastic, but also the tolerability, thanks to the lack of need of lymphodepletion of our patients. So this can optimize the positioning and in some way also the feasibility of CAR-T. And I think that this is another fantastic data. We are going to optimize the treatment that we have discovered in last years. Another important important data that we have seen are the ones that are arriving from the registries. We know that we have seen many reimbursements of drugs and combinations, but we have some unmet medical need to cover. And in particular, LONEUR and Preamble registries have shown some particular sub-analysis in which we can see which is the best sequencing of the agents, which is the best moment to withdraw the treatment, because this is another important point. We want to stop the treatment for the patient that have reached the best in some way response, because the patients want to live without the treatment. The continuous treatment is not anymore our need, and I think that MRD negativity will be the key, the driver point, and we have to understand which is the correct time of sustained MRD negativity to optimize in some way the life of our patients. Another important data that we are understanding better how to administrate the drug, and I think that this also correlates with the quality of life. An interesting sub-analysis from Miraclia study has shown that with the on-body delivery system, the isatuximab new generation anti-CD38 antibody can be administered at home. I participated with my institution to this analysis, and the idea to have a domestic administration of antibodies is something that improves incredibly the quality of life, the patient's reported outcome, and also the staff satisfaction, because we can optimize the places in our hospitals. So all these novelties to confirm that the run toward the cure is not an utopia, is not so far, and this is our dream that we are going to realize, and this is the best wish that we give to our patients, to their caregiver, and to all myeloma researchers.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.